Okay, so today we're going to be doing a cardiac assessment. Starting off, we're going to be inspecting your carotid artery. So you just lean back, just looking for any pulsations, anything like that. I don't see anything. Next, I'm going to palpate. Do one side at a time so we don't cut off any circulation that goes to your brain. And last, we're going to listen. We're going to use the small side of the stethoscope called the bell, and it's to pick up any of the more high-pitched noises. It's good. I was just listening for anything sounded like a bruit or a thrill or just abnormal noises. Next, we're going to be moving on to your heart sounds. So just stay sitting up. I'm going to listen to your 5 points. It's going to be the aortic point, pulmonic point, Erb's point, tricuspid point, and the mitral point. And I'm going to listen with both sides of the stethoscope called the diaphragm and the bell. Okay? Alright, so everything sounds good. I don't hear any abnormal noises. Next, I'm just going to go over some basic cardiac health. If you're having any trouble breathing upon exertion, any cyanosis where your fingertips or your lips start turning blue, any abnormal swelling, any chest pain, probably need to go see a cardiologist. So next, we're going to have you lay down and we're going to do some of the same stuff. We'll listen to your heart sound. I'm also going to feel around to see if I feel any pulsations. And we're also going to take a look at your jugular veins and just look for any distension. I don't see any. Next, we're going to be looking at your chest, see if we see any obvious pulsations. I don't see anything. Next, we're going to feel around. And again, at the aortic point, pulmonic point, Erb's point, tricuspid point, and the mitral point. We're just going to use our fingertip and see if we can feel your pulse. I can't feel it, so I'm going to have you lay on your left side. So you just roll this way. Yep, all the way on your side. There you go. I'm going to try again. This position is called left lateral. It tends to help you feel that point, which is good. Alright, last thing I'm going to do is I'm going to listen to your heart sounds once again while you're laying down. And again, it's going to be with both sides of the stethoscope. Alright, everything sounds good. I don't hear any abnormal heart sounds or any additional pulses or anything like that. So that'll be the end of this assessment. Okay, so patient's carotid arteries had no visible pulsations. I didn't hear any abnormal noises such as bruits or thrills, and the pulse was strong and equal on both sides. Heart sounds were clear upon auscultation. When this patient laid down, jugular vein, there was no distension, there was no obvious pulsations on the pericardium, and once again, all heart sounds were clearly auscultated. That'll be the end of this assessment.